So right now I am sitting on my bedroom floor in my apartment with my phone propped up on some books because I have yet to invest in a tripod. But I will eventually get a tripod and make my videos a little bit more legit. So this video, I just wanted to talk about what my definition of health is. If I'm gonna be making more videos about health and health-related topics, I figured I should probably define what I mean by health, because my definition of health is much different than the Merriam-Webster dictionary definition of health, which states that health is the absence of disease. And I just could not disagree more with that, because I believe health is so much more than not having a disease. And by this definition, if you don't have cancer, if you don't have heart disease, if you don't have diabetes, and your blood pressure is 120/80, that means you're healthy. And, I really don't think that's the case, and I see it all the time in my practice. People will usually come to see me initially for some sort of injury, for example, low back pain, and obviously I assess their low back pain and their symptoms related to that. But then when I'm doing my full intake and asking about all these other things, many symptoms come up that the patient has just been living with their entire life that they think is normal. For example, I always ask about headaches. Do you get headaches? Oh yeah, like once in a while. Okay, how often? Oh, just like once a day. Is not normal. A headache once a day is not normal, and that's not something you have to live with. And yeah, you might not have a full-fledged disease, but that doesn't mean you're healthy. Having a headache every day is not healthy. And I see this a lot too with digestive issues. So many of my patients have digestive issues that they have just been living with their entire lives, and so they believe them to be normal. And because they don't have a definite disease, they think that they're healthy. They're told to believe that they're healthy. But in my opinion, being healthy is functioning at your absolute best. Being physically fit and mentally sharp and emotionally stable and able to deal with whatever life throws at you. Being able to handle the ups and the downs of life, because it's not all rainbows and butterflies. There's going to be hard times in life, and how do you adapt to them? Can you adapt to those hard times? So in my future videos, when I'm referring to health and healthy living, that is the type of health that I'm referring to. And the World Health Organization's definition of health is much more in line with my definition of health. So what they define health to be is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And infirmity means physical or mental weakness. I had to look that one up. I didn't know what infirmity meant, so don't feel bad if you didn't either. So yeah, that is my definition of health, and I think that's what other people's definition of health should be as well. So I really, one of my goals is to change this perception that if you don't have a disease, then you're healthy, because that is really what we're taught to believe. So the moral of this video, if you get headaches every day, get that checked out. That is not normal. If you have diarrhea every day, if you're constipated, or other digestive issues, other common things that I see that people think are normal, menstrual cramps, little aches and pains, like these things are not full-fledged diseases, but you don't have to live your life with them. Because if you have these things, you're not functioning at your best. And it's hard to be as physically fit as you can be. And it's hard to focus at work when you have residual pain or a headache. And if you're not emotionally stable, that's a problem as well. I don't really know how to end these videos. I should come up with some sort of ending tagline or something. I'll work on that. But that is all for today.